everyone, it's breastfeeding time again. I'm here to give you another good information for moms, new moms, for those women who are pregnant right now. So this is the day that you need to gain some information to prepare for yourself and for your baby when it comes to breastfeeding. So today I have chosen a really good topic that would really answers to some concerns of so many moms who are exclusively breastfeeding or half breastfeeding, or you're doing mixed feeding, formula or breastfeeding. Now, I want to talk about a specific topic about breastfeeding and the use of medication, which is specifically antibiotic. Okay, I have so many concerns from moms. I heard so many concerns from moms during our session in our breastfeeding clinic or when I do home visits after birth, that the mom is so unhappy with the healthcare provider telling them to quit and to stop breastfeeding because they're taking antibiotic, and the healthcare provider or the doctor told them to stop breastfeeding until the antibiotic treatment is done, or after 10 days or 14 days, which is normally the treatment regimen for most antibiotics. Okay, 10 days, 14 days. Some doctors will give 7 days, but normally 10 days, 14 days. So it's a headache for so many parents, moms who are breastfeeding, when the doctor will tell them you're not allowed to breastfeed because you're taking antibiotic. Okay, so based on my experience as a lactation consultant and community health nurse, we as lactation consultant, we cannot tell you either to get the medication, take the medication, because we're not doctors. We are lactation consultant. But we can tell you about the side effects of this medication for yourself and for your baby, and it's up to you to decide and ask consultation from your doctor on what's the best decision that you need to do in order for you to stay healthy, at the same time your baby will be fed, or to keep your baby healthy. Now, most antibiotic, based on our study, are compatible with breastfeeding. Okay, but it depends on your healthcare provider who tells you what to do when it comes to antibiotic, because again, they're the one who decides what's best for you. Okay, now the percentage that this medication pass into your breast milk, so I have my breast model here. Okay, so every time you take medication, either over-the-counter medication or medication that's prescribed by your doctor, there's always side effect. Hardly, rarely medication that don't have any side effects at all in our system. Okay, now think about when you're breastfeeding. Okay, when you're breastfeeding, some percentage of the medication really pass into your breast milk. Now I'll give you examples. Okay, if you're taking any medication for headache, acetaminophen, ibuprofen, this medication will pass into your breast milk at least 1 to 2% of this medication pass into your breast milk. So based on the lactation category of how much risk it is for the baby, it's so tiny risk, and for if you base on that risk management for if you take this medication for headache or for fever, it is safe for the mom to breastfeed even taking this medication for headache. Okay, but again, it's up to your doctor to decide, because we as nurses, we cannot decide what's best for you because we're not doctors. I'm just telling you the side effects and what percentage have passed into your breast milk. Now, speaking of antibiotic, so many moms who experience having urinary tract infection or UTI after birth, or complication or infection under incision, their C-section, or just perennial infection after birth, they were given antibiotic for the infection, for treatment, and most doctors would say no breastfeeding while you're taking antibiotic. And they come to our breastfeeding clinic and they start crying. They said, Alona, I really want to breastfeed my baby. My baby is starving. My baby will not take any of the formula that I'm giving him or her because the baby loves my milk and don't want to, no matter what I do, no matter if I give the bottle, even I feed the baby with a spoon or I feed the baby with a cup, the baby will still not take the milk because the baby wants to latch. And it's frustrated because these moms are really struggling hard to maintain breastfeeding. But yet, the doctor says, you cannot breastfeed because you're taking antibiotic. You know what I tell to these moms who are feeling stressed, who really want to breastfeed even if they're taking antibiotic? I give them the option. Okay. There are options. If the baby will not really tolerate artificial milk, and the only way the baby will feed is through the breast milk, then the mom needs to decide, do you want to stop breastfeeding for 2 weeks and follow the doctor's advice, or you want to follow what you want to do for your baby? Because they're the mothers. They can decide for your baby. Okay? The doctors are there to give them the right information, to give them precautions, to give them the knowledge. But if the mom would just insist, I will not stop breastfeeding, I will finish my medication, but I want to breastfeed my baby. So if you are in that point that you don't want to follow the doctor's advice and you want to continue breastfeeding, even though you're taking medication, not just antibiotic, but other medication, you need to understand the side effects of any medications that you're taking, either their pain medication, their antibiotic, or their other medications that can really affect the baby's behavior. Okay, I'm gonna cite some side effects of antibiotic for you first. Okay, if you're taking antibiotic for any infection that you have, either you have UTI, you have chest infection, or you have infection down there after birth, this medication, sometimes the number one side effect of this medication, some women, some people will get diarrhea. Okay, some people will get headache, some people will have abdominal cramps. Okay, these are just 3 very common side effects of this medication. Sometimes if there's a long treatment of antibiotic after birth, or if you have an infection, you may get a yeast infection. Okay, because again, the antibiotic you're taking is killing some of your natural bacteria in your body, and some women or some people will get yeast infection or thrush, meaning thrush for baby. Okay, the whitish of the tongue, or sometimes can even see in the genital area of the child. Okay, even for yourself as well. Now, these side effects of this medication is manageable. Okay, diarrhea. If you have diarrhea, you know what to do. Making sure you're taking, maintaining hydration. You don't want to be dehydrated, because if you're dehydrated, sometimes that will affect your milk supply. If you're having headache, if you're taking antibiotic and you have headache, then you can take maybe medication for your headache, as well as it doesn't contradict the medication antibiotic that you're taking. Make sure you ask opinion from your doctor. Okay, if you're having abdominal cramps, there's so many ways you can do for abdominal cramps, okay? Non-pharmacological way. If you have abdominal cramps, you can put a hot bottle wrapped in let's say a towel or a cloth, put it in your tummy. Laying on your side maybe help with abdominal cramps. Avoid eating food that will make more gasiness in your system, so that helps to relieve abdominal cramps. So that's for yourself, right? Those are interventions if you ever have any side effects of the antibiotic that you're taking. Now for your baby, if your baby is gonna have diarrhea, what's cure for diarrhea for baby? Breastfeeding. You breastfeed more so that the baby will not be dehydrated. But the thing is, some of this antibiotic would really pass into the breast milk, so maybe cause more diarrhea for your baby. So you need to weigh things. Okay, is it really advisable to continue breastfeeding, or to quit breastfeeding for 2 weeks and then pump and dump? So what is pump and dump? While you're stopping breastfeeding for 2 weeks, or depends on how many days the doctor will tell you, then you can manually express your milk every 2 to 3 hours, because if you don't, that milk will slow down or will decrease because the baby is not stimulating it for those number of days that the doctor says you cannot breastfeed. Pump and dump, express or throw away, you cannot save it, because again the doctor says it's not safe. Now again, you're the mother, you are responsible for your baby. You can talk to your doctor, making sure you ask questions, because some doctors sometimes they don't have no time to fully explain to the moms what are the side effects. Are they really risky for the baby? So if it's only 2%, 5%, so we'll see the doctor will decide that if it's really safe. So I hope you learned something from this video, breastfeeding and antibiotic. Make sure you put your comments in there if you have any questions. I would really appreciate if you put your questions in there, and I will promise I'm gonna answer these questions. Please don't forget to subscribe, follow me, and like this video, and share this video to so many moms so that they can get some information as well that is evidence-based and not false information. Bye for now, and I'll see you again for more videos.